Most people don't think about vitamin B12 until something starts going wrong. They feel exhausted even after a full night's sleep. Their hands or feet start tingling for no clear reason. Memory feels foggy. Mood changes creep in. And slowly, quietly, life starts feeling harder than it should. What many don't realize is that one small vitamin B12 could be sitting at the center of it all, influencing energy, nerves, brain function, and even long-term health in ways that are often ignored until it's too late. Vitamin B12 is not just another supplement on a pharmacy shelf. It is a fundamental nutrient your body depends on every single day. Without it, your blood cannot carry oxygen properly, your nerves lose protection, and your brain struggles to function at its best. Unlike trendy vitamins, B12 has decades of solid medical evidence behind it, yet deficiency remains shockingly common worldwide. Vitamin B12, also called cobalamin, is a water-soluble vitamin that the human body cannot produce on its own. You must get it from food or supplements. What makes B12 unique is that your liver can store it for years. This sounds like a good thing, but it's also what makes deficiency dangerous. Because the body uses these stores slowly, symptoms may take a long time to appear. By the time clear signs show up, damage, especially to nerves, may already be advanced. One of the most critical jobs of vitamin B12 is helping your body make healthy red blood cells. These cells are responsible for delivering oxygen to your organs, muscles, and brain. When B12 levels drop, red blood cells become abnormally large and inefficient. Oxygen delivery declines and the body begins to struggle. This leads to fatigue that doesn't improve with rest, weakness, dizziness, pale skin, and shortness of breath. Many people blame stress, aging, or lack of exercise, never suspecting a vitamin deficiency is quietly draining their energy. But the role of vitamin B12 goes far beyond blood. It is absolutely essential for nerve health. Every nerve in your body is wrapped in a protective coating called the myelin sheath. Vitamin B12 helps maintain and repair this coating. When B12 is lacking, nerves begin to misfire and deteriorate. This can cause tingling, numbness, burning sensations, loss of balance, muscle weakness, and coordination problems. In severe cases, walking can become difficult, and falls become more likely. What makes this especially concerning is that nerve damage from vitamin B12 deficiency can become permanent if not treated early. Unlike fatigue, which may improve quickly, damaged nerves heal slowly, and sometimes not at all. This is why early awareness and testing are so important. The brain is another major victim of low vitamin B12. The vitamin plays a key role in brain chemistry, neurotransmitter production, and cognitive function. When levels are low, people may experience brain fog, memory lapses, difficulty concentrating, irritability, anxiety, and depression. In older adults, prolonged deficiency has been linked to cognitive decline and dementia-like symptoms. Alarmingly, these neurological effects can occur even when blood counts appear normal. This means someone can be told their labs are fine, while their brain and nerves are still suffering. Vitamin B12 is also crucial for DNA synthesis and cell division. Every time your body creates new cells, B12 is involved. This makes it particularly important during pregnancy and early childhood. Low B12 levels during pregnancy can increase the risk of birth defects, developmental delays, and poor neurological outcomes in infants. In babies and young children, deficiency can lead to delayed milestones, poor growth, and long-term neurological harm. So where does vitamin B12 come from? Naturally, it is found almost exclusively in animal-based foods. Meat, fish, poultry, eggs, milk, yogurt, and cheese are primary sources. Liver and shellfish are especially rich in B12. Fish like salmon, tuna, and sardines provide substantial amounts as well. Because plant foods do not naturally contain vitamin B12, people following vegetarian or vegan diets are at much higher risk unless they consume fortified foods or take supplements regularly. However, diet alone doesn't explain the full picture. Many people consume enough B12 on paper, but still become deficient due to absorption problems. Vitamin B12 absorption is a surprisingly complex process. It begins in the stomach, where acid helps release B12 from food. A special protein called intrinsic factor then binds to B12, allowing it to be absorbed in the small intestine. If any step in this chain fails, deficiency can occur. As people age, stomach acid production naturally declines, making B12 absorption less efficient. Long-term use of acid-reducing medications such as proton pump inhibitors and H2 blockers can further interfere with absorption. Conditions like gastritis, pernicious anemia, celiac disease, Crohn's disease, and prior stomach or intestinal surgery also raise the risk. Even commonly prescribed medications like metformin, used for diabetes, have been shown to reduce vitamin B12 levels over time. This is why vitamin B12 deficiency is especially common among older adults. Many eat balanced diets yet still struggle with low levels. Without routine screening, deficiency can go unnoticed for years, silently affecting nerves and brain function. The symptoms of vitamin B12 deficiency often develop gradually. Early signs may include persistent fatigue, weakness, lightheadedness, and pale skin. As deficiency progresses, neurological symptoms appear: tingling in the hands and feet, numbness, balance problems, muscle weakness, and slowed reflexes. Mental and emotional symptoms may follow, including forgetfulness, difficulty focusing, mood swings, depression, and irritability. In advanced cases, vision changes, confusion, and personality changes can occur. One of the most dangerous myths is that vitamin B12 deficiency is easy to spot. In reality, it often hides behind vague symptoms that mimic other conditions. That's why unexplained neurological or psychological changes should never be dismissed, especially in people with known risk factors. Diagnosis usually starts with a blood test measuring serum vitamin B12 levels. However, this test alone is not perfect. Some individuals fall into a low normal range but still have functional deficiency. Additional tests, such as methylmalonic acid and homocysteine, can help identify deficiency at the cellular level and provide a clearer diagnosis. The good news is that vitamin B12 deficiency is highly treatable. Treatment depends on the cause and severity. Mild deficiency due to low intake can often be corrected with oral supplements or dietary adjustments. High-dose oral B12 supplements can be effective even in people with absorption issues because a small percentage is absorbed passively. In more severe cases, or when neurological symptoms are present, vitamin B12 injections are commonly used. These bypass the digestive system entirely, delivering B12 directly into the bloodstream. Injections are often given frequently at first, then spaced out for long-term maintenance. Many people notice improvements in energy and mental clarity within weeks, though nerve recovery can take months, and some damage may be permanent if treatment is delayed. There is a widespread belief that taking too much vitamin B12 is harmful. In reality, B12 is water-soluble and excess amounts are usually excreted through urine. Toxicity is extremely rare. For most people, supplementation is safe and well tolerated when taken appropriately. Another common misconception is that vitamin B12 is an instant energy booster for everyone. If your levels are already normal, extra B12 will not magically increase energy or performance. Fatigue has many causes, and B12 is just one possible factor. Supplementation should be guided by need, not hype. Vitamin B12 also works closely with other nutrients, especially folate and vitamin B6. These vitamins cooperate in red blood cell production and homocysteine metabolism. High folic acid intake can sometimes mask a vitamin B12 deficiency by correcting anemia while allowing nerve damage to continue. This makes proper testing even more important. For vegetarians and vegans, consistent vitamin B12 supplementation is essential for long-term health. Fortified foods can help, but they must be consumed regularly and in adequate amounts. Periodic blood testing ensures levels remain safe. In older adults, routine B12 monitoring can help prevent cognitive decline, balance problems, and loss of independence. In people with diabetes using metformin, regular screening is a smart preventive step. Anyone experiencing unexplained fatigue, neurological symptoms, or memory changes should consider vitamin B12 deficiency as part of the evaluation. Vitamin B12 may be small, but its influence is enormous. It supports your blood, protects your nerves, fuels your brain, and safeguards your DNA. Deficiency can quietly steal quality of life, while adequate levels help preserve clarity, strength, and vitality as you age. Understanding vitamin B12 is not about fear, it's about awareness. When you know the risks, recognize the symptoms, and test early, you gain control. And sometimes, protecting your future health starts with paying attention to one simple vitamin today. Vitamin B12 deficiency is especially dangerous because it can harm the nervous system quietly, without obvious warning signs, and sometimes even before routine blood tests show anything abnormal. Many people assume that if their basic lab reports are within the normal range, their nerves and brain must be safe. Unfortunately, that is not always true. Vitamin B12 plays a critical role in protecting nerves by maintaining the myelin sheath, a fatty layer that insulates nerve fibers and allows electrical signals to travel smoothly. When B12 levels fall, this protective coating begins to weaken, exposing nerves to damage long before symptoms become severe. What makes this situation even more concerning is that neurological damage does not always happen alongside anemia. Traditional blood tests often focus on hemoglobin and red blood cell size, but nerve and brain injury can begin even when these values appear normal. This means a person may be reassured that their blood work is fine, while subtle nerve damage continues in the background. Early symptoms may be mild and easily dismissed, such as occasional tingling in the hands or feet, slight numbness, or a feeling of imbalance. Over time, these signs can progress into persistent numbness, burning sensations, difficulty walking, and coordination problems. The brain is equally vulnerable. Low vitamin B12 levels can interfere with neurotransmitter production and brain metabolism, leading to memory problems, difficulty concentrating, mental fog, mood changes, anxiety, or depression. In older adults, prolonged deficiency has been linked to cognitive decline and dementia-like symptoms. Because these changes develop gradually, they are often mistaken for stress, aging, or emotional issues rather than a nutritional deficiency. The most alarming part is that nerve damage caused by prolonged vitamin B12 deficiency may become irreversible if not treated early. This is why relying only on standard blood tests can be misleading. When unexplained neurological or cognitive symptoms appear, vitamin B12 deficiency should always be considered, even if routine lab results look normal. Feeling constantly tired, mentally foggy, or emotionally low is often blamed on stress, lack of sleep, or simply getting older. While these factors can certainly play a role, they are not always the true cause. One frequently overlooked reason is low vitamin B12, a deficiency that can quietly deprive your cells of the oxygen and energy they need to function properly. Vitamin B12 is essential for the production of healthy red blood cells, which carry oxygen from your lungs to every tissue in your body, including your brain. When B12 levels drop, red blood cells become fewer, larger, and less efficient at delivering oxygen. As oxygen delivery declines, the body enters a state of low-grade energy starvation. Muscles feel weak, daily tasks become exhausting, and even simple activities feel like hard work. Mental performance also suffers. The brain is highly sensitive to oxygen supply, and even a mild reduction can result in brain fog, slow thinking, poor concentration, and forgetfulness. People often describe feeling not sharp anymore, or as if their mind is constantly tired. Low vitamin B12 also affects mood and emotional well-being. It plays a role in the production of neurotransmitters such as serotonin and dopamine, which regulate mood and motivation. When B12 is insufficient, these chemical messengers can become imbalanced, increasing the risk of depression, irritability, anxiety, and emotional flatness. In some cases, people are treated for depression without realizing that a nutritional deficiency is contributing to their symptoms. What makes this especially misleading is that these symptoms develop gradually. There is no sudden collapse, just a slow decline that feels easy to normalize. People push through fatigue, accept mental fog as normal, and assume low mood is part of life. Without testing, low vitamin B12 can remain undetected for years. Identifying and correcting this deficiency can restore energy, mental clarity, and emotional balance in ways that feel almost life-changing. Many people assume that if they eat foods rich in vitamin B12, deficiency should not be a concern. In reality, eating enough B12 does not always guarantee that the body can absorb and use it properly. Vitamin B12 absorption is a complex, multi-step process that depends heavily on stomach acid, a healthy digestive system, and specific proteins that work together to move B12 from food into the bloodstream. If any part of this process is disrupted, deficiency can develop even in people with seemingly adequate diets. The process begins in the stomach, where strong stomach acid helps release vitamin B12 from the protein it is bound to in food. As people age, stomach acid production naturally declines, making it harder to free B12 for absorption. This alone places older adults at a much higher risk of deficiency. In addition, many commonly used medications reduce stomach acid even further. Acid-reducing drugs such as proton pump inhibitors and H2 blockers, often taken long-term for heartburn or ulcers, can significantly interfere with B12 absorption over time. After B12 is released in the stomach, it must bind to a protein called intrinsic factor. This protein is essential for absorption in the small intestine. Conditions such as pernicious anemia, chronic gastritis, or autoimmune disorders can reduce intrinsic factor production, leading to severe B12 deficiency regardless of dietary intake. Gut health also plays a major role. Disorders like celiac disease, Crohn's disease, bacterial overgrowth, or a history of intestinal surgery can impair absorption at the intestinal level. Even medications unrelated to digestion can affect B12 levels. Metformin, a widely used diabetes drug, is known to reduce vitamin B12 absorption with long-term use. Because these absorption issues develop slowly, deficiency often goes unnoticed. This is why vitamin B12 status should be evaluated based not only on diet, but also on age, medications, and overall digestive health. Tingling, numbness, balance problems, and memory issues are often brushed off as minor or temporary, but when they are caused by vitamin B12 deficiency, Ignoring them can have serious and lasting consequences. Vitamin B12 is essential for maintaining the health of the nervous system, particularly the myelin sheath that surrounds and protects nerve fibers. When B12 levels remain low for an extended period, this protective layer begins to break down, leaving nerves exposed and vulnerable to damage. At first, the symptoms may come and go, creating a false sense of reassurance, but ongoing deficiency allows the damage to slowly progress. Tingling and numbness typically begin in the hands and feet, where the longest nerves are most vulnerable. Over time, these sensations may become constant, accompanied by burning pain or reduced sensitivity to touch and temperature. Balance issues can develop as nerve signals between the brain and muscles become less reliable, increasing the risk of falls and injuries, especially in older adults. Walking may feel unsteady, and coordination may gradually worsen, making everyday activities more difficult and unsafe. Memory problems and cognitive changes can also emerge as vitamin B12 deficiency affects the brain. People may struggle to remember names, follow conversations, or concentrate on tasks they once handled easily. These changes can be subtle at first, but may progress into confusion, slowed thinking, and dementia, like symptoms if the deficiency remains untreated. What makes this especially concerning is that neurological damage caused by prolonged B12 deficiency may not fully reverse, even after treatment begins. While early symptoms often improve once vitamin B12 levels are restored, delayed treatment increases the risk of permanent nerve injury. This is why persistent neurological or cognitive symptoms should never be ignored. Early testing and timely treatment can prevent long-term damage and preserve nerve and brain function before the changes become irreversible. Vitamin B12 deficiency stands out as one of the most preventable yet frequently overlooked health problems. What makes it especially important is the contrast between how easy it is to treat and how dangerous it can be if missed. When identified early, correcting a B12 deficiency is often simple, affordable, and highly effective. Oral supplements, dietary adjustments, or injections can restore levels and stop further damage. However, when diagnosis is delayed, the consequences, particularly to the brain and nervous system, can be serious and sometimes permanent. Early testing plays a crucial role because vitamin B12 deficiency often develops silently. Symptoms may be vague, gradual, or easily mistaken for stress, depression, aging, or other medical conditions. Fatigue, memory lapses, mood changes, tingling sensations, and balance problems may appear slowly, allowing the deficiency to go unnoticed for years. During this time, nerve cells and brain tissue may be sustaining ongoing damage. Once nerve injury becomes advanced, full recovery is not always possible, even with proper treatment. Testing for vitamin B12 is straightforward. A simple blood test can provide valuable insight, and when results fall into a borderline range, additional markers such as methylmalonic acid or homocysteine can help confirm deficiency at the cellular level. Identifying low levels early allows treatment to begin before irreversible harm occurs. This is particularly important for older adults, vegetarians and vegans, people with digestive disorders, and those taking medications known to interfere with B12 absorption. The long-term benefits of early detection are significant. Maintaining adequate vitamin B12 levels helps preserve memory, concentration, balance, and nerve function as you age. It supports mental clarity, physical stability, and independence. In many cases, a small step, early testing, can protect brain health for decades. Vitamin B12 deficiency may be easy to fix, but only if it is recognized in time.